And CGTN Silkina Ahluwalia is joining us now live from Jakarta. Hi there, Silkina. Indonesia's top Muslim clerical body has recently ruled that parents could still have their children vaccinated, given the need to protect public health. How have parents responded to this?
Well, it's still too early to tell. Of course, the goal is to have them respond positively. But the thing is, the Indonesia Ulama Council, or MUE, is one of the country's largest Islamic organizations, and they have ever said that vaccines are not halal. And this is when the issue began. They went as far as stopping vaccine campaigns by local health agencies, and that created an even larger issue because as a Muslim-majority nation, Indonesia is somewhat religious, and that statement put off many families. Tomorrow, the Islamic Council will meet with manufacturers in a meeting that's specifically organized to release halal certificates, not just for vaccines, but medicines as well. And it's about time, because Indonesia experienced a rubella outbreak recently in Aceh because only 7% of children are vaccinated there. So regulations need to be strengthened to avoid similar cases in the future. In 2017, Indonesia had the third highest measles outbreak in the world. The health ministry is working hard to come up with campaigns to encourage parents to not be afraid of vaccinations. Their existing campaigns only managed to convince 30% of people, and that's not enough. Their initial target is 95%, so they still have a long way to go. But a positive official statement from MUE is needed because it will be important for Indonesia's health industry in the long run. Mang?
Now, Silkina, if a halal vaccine, which is aligned with Islamic law, is not readily available, how are health authorities addressing the immediate threats to the children who are not vaccinated, and how can they balance the public health worries with parents' religious concerns?
That's a very good question, and it's a complicated one. Right now, many of the families here do not know the consequences of not vaccinating their children. That's why education is very important. The government is also spending millions of dollars on their campaigns, at least $60 million US. They have made it a priority because they say it is an emergency situation. We know that vaccines for vaccines to be effective, at least 90% of the population needs to be vaccinated. And that is not the case for Indonesia, which makes the country very vulnerable. And now they have addressed it as a religious issue because in Hindu-majority Bali, at least 60% are vaccinated compared to Aceh, which, as I mentioned before, only has a 7% vaccination rate. But the thing is, to come up with a new vaccine component can take as long as 15 years. On top of that, research takes time. So the health ministry and MUE really needs to work together to start testing ingredients in these vaccines and come up with a plan to make the parents feel safe about vaccinating their children.